Hello, and thank you for joining us today for talking about our equality outcome setting for 2025 to 2029. Before I do that, I'd like to introduce you to the full team leading on the equality outcome consultation. So my name is Jackie Duncan. I'm the Care Inspectorate's Equalities Professional Advisor. I'm working alongside Claire Egan, who is our Participation Coordinator, and Amanda Took, our Participation and Equalities Team Manager. As many of you will know, consulting on equality outcomes is not just important, but it's actually a legal requirement under the Equality Act 2010, Specific Duties Scotland Regulations 2012. This means that we are required to consult with individuals who share a relevant protected characteristic. So right now we're engaging with a wide range of stakeholders, both internally and externally, to make sure that our equality outcomes reflect diverse perspectives. Our work is guided by the Equalities and Human Rights Commission, which is the regulator of the public sector equality duty in Scotland. They advise that these outcomes should be based on evidence, focused on specific areas of inequality, and they should be SMART, so specific, measurable, achievable, relevant and time-bound. So we aim to align our outcomes with both internal and external priorities. Over the next 4 years, our equality outcomes will guide how we approach equality, diversity and inclusion. This doesn't mean we won't focus on other areas. However, our equality outcomes are what we will concentrate on achieving during 2025 to 2029. There's a requirement for this to be mainstreamed. In other words, our equality outcomes will be incorporated into our day-to-day work, so it's vital that we get them right. In terms of our internal environment, so our work as an employer, we are striving to increase the representation of individuals living with disabilities and those from diverse racial backgrounds in our workforce. Employee engagement is key, so we're increasing our focus on engaging colleagues who belong to protected characteristic groups, listening to their experiences and empowering them to drive positive change. We have a number of employee networks for colleagues who are interested in supporting unpaid carers, care experience individuals, LGBT individuals, and initiatives such as improving race equality and helping us to become anti-racist. And we're also in the process of setting up an accessibility group. So that will focus on things such as disability, neurodivergence, and invisible health conditions. So within our organisation, we're committed to principles like being trauma-informed, improving employee well-being and employee engagement. And these align with the Fair Work principles, which focus on ensuring an effective employee voice and promoting inclusion and belonging. In terms of our external environment, so our work as a scrutiny and quality improvement body, the research tells us that certain groups face significant barriers in accessing health and social care. This includes people living with long-term conditions, disabled individuals, women, Black and minority ethnic communities and LGBT+ people. So it's crucial that our equality outcomes focus on reducing these areas of inequality. As a scrutiny and quality improvement body, we're already making strides in areas like reviewing our quality frameworks, developing guidance and toolkits, and raising awareness on important topics such as meaningful connection, the promise, modern slavery. This all demonstrates a rights-based approach. And we want to further strengthen our approach to support equality, non-discrimination and participation. And this will help us to meet the commitments in our corporate plan. This includes delivering high quality care, improving outcomes for all, and ensuring that everyone's rights are respected and realised. We also align our equalities work with Scotland's National Performance Framework to ensure our outcomes contribute to national priorities. Finally, I'd like to invite you to take part in our consultation. Please complete the survey by November 11th to ensure your valuable input is included. We're also hosting conversation cafes to provide another way to hear your feedback. We have one on Thursday the 10th of October between 11 and 12:30. This is for professionals, so for example providers or people working in health and social care.
and we have another one on Thursday the 24th of October between 1:30 and 3. This is for people who experience care, their loved ones, or are unpaid carers. The cafes will take place online via Microsoft Teams. To reserve your spot, please fill out the booking form and let us know if you need any assistance to participate. Thank you for taking the time to listen and in advance for providing your feedback. We greatly appreciate your input and we look forward to hearing your thoughts and insights. Thank you.